Small cell lung cancer is one of the most aggressive and deadliest types of lung cancer, yet for decades, treatment options saw little to no advancement. But now exciting advancements are rewriting the story for some patients and giving doctors new tools to fight back. Joining me now to discuss is Dr. Jacob Sands, thoracic oncologist at Dana-Farber Cancer Institute, and Wendy Brooks, a small cell cancer, lung cancer survivor, I should say. So thank you both so much for joining us, and I'm so glad that you're doing well, Wendy. We'll hear your story in just a second, but doctor, let's start with you. What exactly is small cell lung cancer?
Well, small cell lung cancer is a kind of lung cancer that tends to grow more rapidly. It is a more aggressive kind of lung cancer. When a biopsy is done and those cells are looked at under a microscope, those cells look smaller, hence the name many years ago that was given of being small cell lung cancer.
How do you prepare your patients for this particularly aggressive diagnosis?
Well, for any individual, we talk about what's going on for them. We talk about the stage, we talk about the different treatment options in their specific scenario, and then we choose what is the best thing for them. And sometimes that's based upon all the science, and other times it can be based upon logistics. I mean, we really talk about this in a very personalized way to deliver the right treatment for them. You know, I'll highlight, though, that clinical trials, there's so much going on. The science has advanced so rapidly that really all of lung cancer, with rare exception, patients are getting treated with a drug that is new within the last 5 or 10 years. And now in non-small cell lung cancer, we really saw a lot of advances. But in the last 5 years is where we're really starting to get a lot of traction in the treatments for small cell lung cancer specifically. And so there's much more to talk about, but clinical trials are a really important part of that discussion.
Yes, and we're definitely going to touch on that. But Wendy, I want to hear a little bit of your story of when you got diagnosed. What can you tell us?
Well, I was diagnosed in July of 2023 after my 6th annual low-dose CT screening of my chest. I was at risk for developing lung cancer. I had a family history. My father had passed away in 2013 from lung cancer, and I had a bunch of environmental exposure risks throughout my life. So I petitioned and worked with my primary care physician to get into a lung screening program early. And I'm glad that I did, because that's what found the cancer for me. I didn't have any symptoms at the time, and so having those annual CT screens really did save my life.
Wow, that's so scary to hear, too, that there were no symptoms. So I'm glad that you went ahead and were proactive. Now, did you do any of those clinical trials that the doctor was talking about?
Actually, I did. I'm on my 2nd clinical trial. My 1st clinical trial was one of those antibody drug conjugates, which is the targeted chemotherapy that goes directly to a protein that's expressed in small cell lung cancer. So that's just great science, that it's not a chemotherapy that broadcasts and tries to kill every fast-growing cell, but just really pinpoints down to the cancer itself. And I did tremendous with it. I had a volume decrease of my tumor of 70%. And when it started to increase just a little bit, we decided to pivot at that time and go on to another trial, which Dr. Sands described as one of those T-cell engagers, where it is actually working with my immune system to go attack the cancer and kill it. And it's doing very well. I have been on this since January of this year, and I feel great. My cancer is stable, it's not spreading, and I'm able to enjoy life and do the things that I really want to do.
So what should patients be asking their doctors then in regards to these new treatments?
Well, one, I'd ask, tarlatamab, I mentioned as that first drug from the class of T-cell engagers that's approved. Is that available in the center that you're at, or do you need to consider getting that somewhere else? And then also, what are the clinical trials available at that center, and where's the center nearby that's going to have the most options? You really want to go to that center to find that out, just so you're making an informed decision about what's the best treatment for you. You just want to be aware of these different treatment options. The science is moving so fast at this point. It's exciting to see these advancements now coming so much more quickly, and we want to keep moving that along, but we want people to have the opportunity to benefit from the technology that exists today.
Well, if we want a little bit more information on all of this, where can we go?
To join the fight and to donate, please go to lcfamerica.org.
Wonderful. Thank you both again so much for joining us today. Wendy, I'm so glad that you're doing well.
Thank you so much, Jordan.
Of course. And everyone at home, if you'd like to see this interview again, just head to First Coast News Plus.